The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
Well, it's obviously not functional, so it needs to come out.
That's what they see, right? When I think, man, we ought to go back and turn back on the circuit breaker. Right? I mean, they didn't even try to. Anyone look at that? Anyone even consider looking at your back before they remove the organs?
No, actually they didn't.
Oh, my gosh.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Good morning and welcome to the Unplugged Healthcast. It's time to wake up. This is where we unplug you from the matrix of today's healthcare system so you can see clearly. My name's Dr. Kevin Wall. And we're excited to have you back to the Unplugged Healthcast. And if you've not been here or met us before, let me give you a little bit of information that you're going to want to know. This is where we have real conversations with real people about real health problems. And we help them and help you unplug from today's confusion. We know that our healthcare system has been failing us for quite a while. Chronic illness is headed in the wrong direction. We have anywhere in the upward categories of 150% increase in chronic disease. All the while, medical breakthroughs, technology, diagnostics, patient treatment options, that is going through the roof as well. The problem is that's ironic. They should be going in opposite directions. So we are here and existing to help you understand how to unplug. That's what the Unplugged Healthcast is all about. I'm Dr. Wall, your host. We're excited to have you back. Okay, just some general rules. Again, if you haven't been on before, you're going to want to know some basic principles of what we're going to do and how we're going to do it. As we said, with the healthcare system failing us, we need to find a new way to think, a new way out. We need to find hope for your health. And here's how we're going to try to do it. There's 4 principles I'm going to be talking about when I talk with patients here soon. People, I mean, not my patients, just people calling in. And we're going to apply these 4 principles. I'm going to quickly review them. That number 1, health is not as complex as you think it is. Health is more simple at times. In the analogy of a farmer, it is food, water, and sunlight, because oxycodone, Diet Coke, ibuprofen, and Taco Bell kill plants. All right, got it? Number 2 is that if we actually decided to consider putting oxycodone, Diet Coke, and ibuprofen into plants, that doesn't go well. Don't put it in humans very long, very often, or surely not for a lifetime. That's my thought. Number 3 is you are the doctor. You are the healer. It's not that you don't listen to your doctors, but just realize and take responsibility that you heal. You're the healer. Healing is an inside thing, not an outside thing. No one can really heal you, but they can help you heal, but you have to help them. And number 4, that's probably as important as any, is pain is not your problem. See, pain is the last thing to show usually and the first thing to go very often. In the areas of chronic illness like heart disease and cancer and diabetes and anything you want to go even way to tooth decay, pain often shows when your body just can't go any longer. It's the alarm system. It's the red oil lights. It's the blinking lights saying there's something wrong inside. We don't just spray those lights up with black paint. We think We need to understand. We look at function. We look at the anatomy. We look at systems and realize that not one system is independent of any other system. They all work together. So knowing that, you got the basis of what we're going to maybe implement, talk about, and help you think more clearly. This is the Unplugged Healthcast. I'm Dr. Kevin Wall. Thanks for joining us. All right. Topic today, before our callers are, because we'll take topics, we'll bring guests. Today we're going to talk and start a conversation about a problem that's probably, I think, more of an epidemic than some of the corona has ever been, because this one has been going on much longer and it has a far-reaching impact on so many different areas, issues, problems, conditions. It is the simple phrase called indigestion. You may have said or been told you have acid reflux, maybe IBS. Maybe you just have a tummy ache and you've been taking the Tums every day. Maybe it's heartburn, bloating. I don't know what you call it. I call it not functioning correctly. See, let's look at the word to start the solution. We think indigestion is a disease. Okay, I need you to understand and ask yourself this question. What is the process of digestion all about? Because indigestion, by its true definition, just means not digesting. I don't know if you know, but maybe you've heard digesting your food is kind of important. That you would have to take what is called a macromolecule. Let's use a T-bone, for example, and you need to make it into a very small micromolecule so your body can bring it in and use it for good. Energy, repair, regeneration, general activity, function, things that you do and take for granted every day, your body is doing or trying to do, and it needs really good digestion. If you have indigestion, then that just means you are not digesting. It doesn't automatically mean you need Tums or Prilosec. Let's think, folks. Come on. Wake up, America. Time to get unplugged. Here we go. Today is the beginning of probably a multiple series that you're going to need to show up for. Subscribe now so you don't miss them, because they all are part. There are about 8 different things minimally, and I'm just going to hit the highlights because I know there are more, but for the sake of these conversations and some of the arguments that will ensue, there's about 8 things that you got to be able to do that can take a T-bone down to the smallest form where your body can actually do something with it. All right, we're going to just hit the first one. First one is chewing. See, when your body is chewing, your body is actually starting to prepare for what's coming. And if you chew long enough, your body can actually prepare and get ready and help you digest what's coming next better, meaning that it produces enzymes in your mouth. It produces things to help you break down the food before it even starts. More than just your jaws, your body is secreting fluids to help digest it. So if you just took a little longer chewing your food, that could be the beginning of the reduction or elimination of your indigestion or other bowel digestive issues. But just for the sake of wrapping up this conversation and keeping this short enough where I won't lose your focus or your ability to follow me, let's just hypothetically say that one of the 8 problems that I'm going to discuss, like chewing or some of the other things going on inside your liver, gallbladder, digestive system, pancreas, maybe some of those are not working. Well, your body has one thing in its stomach. Does anybody know what that one thing is that helps you digest your food? Hopefully you said acid, because there is acid in your stomach. That's natural, that's normal, and you need it. In fact, without it, you're in trouble. It's one of the major systems that your body's going to use to help you break down the food. But if one of the other parts are not working very well, if you were the body, which you are, by the way, but let's just say you were working and running the system and a couple of the parts were not working, or in many cases, out of the 8 systems needing to break things down, 5 or 6 weren't going, any idea what would happen to your acid levels? See, if you didn't come to the conclusion that they would naturally go up because your body's going to try to actually break your food down, and so it kind of compensates by giving you more acid than you want, then reflexing up into your throat often. And I get that that's uncomfortable and you don't want it, but let's just logically think what happens. You now take a acid reducing medication of some sort, or Tums, or whatever it is you are trying to do to reduce the acid. Did you increase or decrease your digestion problems? See, if you didn't come to the conclusion that you just actually made your indigestion worse, then you probably didn't follow me, and that's my bad communication, and I will continue to try later. Today we don't have time, but if you did follow me, you understood that by reducing the acid levels in your stomach, you maybe felt better and didn't have the throat concern, irritation, reflux, but you actually made the process of taking that T-bone and turning it into something your body can use. You actually made that less. And you may have made it significantly less. And as a result, you will find, and you remember, if you're on these medications, I can about guarantee, because I've seen it for 35 years, millions of patient visits, that you will probably have significant fatigue within a year or so after starting those meds. Not only is that possibly a side effect, but it's more of an effect of your body's inability to break food down so you don't have any energy anymore. You may then actually start to gain weight. There are so many compensatory reactions that occur when your body cannot digest food correctly. And you spray painting over the light, just muting the acid reflux symptoms or feelings, actually probably is making you worse. All right, well, there it is. We tiptoed into the tulips. As Tiny Tim would say, I'm too old maybe for you, and you missed that joke. It doesn't matter. You probably got the point that we are just dipping into the possibilities and trying to give you some thoughts that you can consider. Realize, as my disclaimer to you always, is that whatever information I'm giving you and whatever conversations we have with these people calling in, these are just conversations and thoughts and concepts and just science, and often it's my opinion. Take it for what you want, and please do not apply it like it's a doctor's recommendation for you to go about changing your whole life and treatment without somebody helping you that maybe is not me. I'm not your doctor. I am just playing one for today's purposes on your TV or your podcast. All right, I am a health provider, though, and I'm going to help. And in a few minutes, we're going to bring on our first caller, and we're going to see if we can't unplug somebody from something and bring light to them, as well as show you some things that you could learn from as well. All right, we're going to take a quick break, and as soon as we get back, we'll have our first caller on site or on phone. I'll see you in a minute.
Pain holding you back? AFC Physical Medicine and Chiropractic Centers of Phoenix have real solutions to get your life back. With 9 valley-wide locations, we offer integrated care including chiropractic, medical, and nutritional support. Our approach goes beyond prescriptions, combining therapies to help you thrive. Don't let pain define your story. Take the first step towards living life to its fullest. Call us now at 480-210-6103 or visit afcchiropractic.com to schedule your appointment.
All right, well, welcome back to the Unplugged Healthcast. We are excited to have you back here, and we are having real conversations with real people about real problems. I'm Dr. Wall, your host. We're going to bring on Peter from Portland here in just a moment. Just realize, as everyone knows, and I say often, Peter is not his real name. We're protecting privacy. He is a real person, probably with a real thing he's willing to share, help us learn. We're going to just hear and see and learn and see if we can help in any fashion. So, Peter, are you there?
I'm here.
Awesome. I appreciate your time, and hopefully today we can maybe help in some fashion. So I'm going to run through maybe and ask a lot of questions. Our call will probably only be 10 to 15 minutes, and hopefully at some point I'll come up with something maybe that would help you or at least shed some light. So let's start off with, if you will, on lower back pain, and tell me the first time you ever noticed having anything in your lower back that was different, not maybe just this level of pain, but just sore spasms or injuries. Can you take me back?
Yeah, I would say my junior year in high school when I was playing football, I started to notice tightness in my back and having to warm up more than most.
Okay, and just for the sake of the callers, if you don't mind, how old are you now?
40.
Okay, so we're talking 20 plus years of having some lower back stuff. And if I would to guess, because I'm pretty prophetic sometimes, it's probably got a little more obvious, a little more often, a little more concerning. Am I right or wrong?
You are 100% correct.
Yeah, unfortunately, 35 years of doing this, I've seen it too much. And let's take a look further. So, all right, in the process of that, I'm assuming you probably did what most people do, kind of thinking it's okay, living with it a little bit, not that concerned. It wasn't that bad, right?
Yes, that's exactly correct.
I use this as a reference point because it's kind of the one thing that we've been trained to do as I speak to people maybe on the podcast listening is that, it's kind of crazy, but it's not so unhuman that we kind of see the light come on in our car and we just keep driving. Thinking somehow that's going to be okay. Now, sometimes the light shuts off on its own, no big deal. But many times it doesn't. It just continues to kind of get maybe sometimes a little brighter, a little dimmer, a little brighter, a little dimmer. And then it gets to the point where all of a sudden it's pretty bright, it's blinking, and all of a sudden the car is acting weird. Does that sound familiar to you at all?
It sounds eerie familiar.
Yeah, unfortunately, I'm a little too good at this, not always fixing, but understanding. I get it, dude. All right, well, in that process, can I maybe go to referring symptoms? Because often what people don't realize is that lower back pain isn't really your problem. It's one of the rules of our podcast. Pain's not your problem. It's your friend. It tells you something's wrong. And chances are it's probably often, if it doesn't get corrected, which now 20 years of it, it's probably caused other issues, I'll bet, because the pain is probably from nerves in your lower back, not too happy. Have you ever seen kind of pictures of what your lower back looks like on the inside?
I think just once a few years back, yes.
Okay, well, just for the sake of argument, everyone listening, there are a lot of nerves inside your spine, coming out of your spine, going everywhere. Your arms, your legs, your feet, your prostate, your bladder, your bowels, and they're making things work. Your brain is controlling it, and it's sending life-sustaining messages back and forth in the hopes that everything goes right, keeps right, stays right, and you live and go for as long as you can without having to, stop at the pit. But, all right, now we got the car been kind of wobbling for 20 years, and is it going down into your hips, into your legs? Have you had that yet?
Yeah, mostly right now in the hips and thigh area.
Gotcha. So it's the front already. As soon as we go to the front of the leg, we know that is probably your fourth lumbar or your third lumbar. It's not the bottom where often people get the fifth lumbar, which they heard of. And it's not sciatica, although people may tell you have sciatica because that's the femoral nerve. Either way, we're getting close. We know it's probably an L3 problem. L3 also has issues where it causes knee issues and bladder problems often, or even some digestive issues. Any chance that you'd be willing to share anything with that been going on?
Sure, knee pain and digestive issues.
Yeah. Well, for the sake, again, of people and hearing this, as you can see, there is no one thing disconnected from another in the human body. It all runs together. It's all connected, and the system that connects it all is the nervous system. And unfortunately, when your spine gets jacked up, then we start to mess with those things. So, all right. Well, we see the issues, we see the complications, we now see the progressive nature of it. The concern that you should have, that I just will say, not to ask you and make you feel uncomfortable, is as you go for the next 10 or 15 years, you probably know where this car's headed, right?
Right.
So we do not want you doing that, and so we always encourage you not to listen to me. I'm not your doctor, but I am, playing one on TV today, to go and get a look at, but you need to look at somebody who actually thinks like this, where they're saying, we got functional issues. We're not just going to give you painkillers. We're not going to burn your nerves right off the bat. We're not sending you to surgery without looking logically at some other options. Let's consider first off, maybe some x-rays, maybe some MRIs, maybe something to see if the back is an issue relative to one of three things, because it's going to be one of these three things almost for sure. We're going to have biomechanical, positional issues. Either something's twisted, turned, pinching, something. That easily can come from football injuries or things in high school, like I bet you did. You sound like maybe you've been an athlete.
That's correct.
So those things kind of start to twist and torque you, and then, you go into the rest of your life. I'm sure you haven't made that easier. Maybe some holiday weekend sports, all kinds of things, and it just throws a little gas on that fire. But the nerves are irritated. The back's maybe just simply out of position, and it needs some help biomechanically. Physical therapy is great at this. Chiropractor is great at this. Functional physical medicine is great at this. But in general, we don't want to just go in and start shooting a bunch of drugs and things in there unless we find some real reasons that you couldn't get that reversed. If there are other things, second level is the disc has gotten weird. That could be protruded, extruded, could be degenerative, could be bulging, or you could have just blown the thing out. I doubt it, because you would probably be much more severe in pain, and you possibly could be having severe digestive issues. And we won't visually illustrate what that would look like, but if you've blown that disc out, it's pretty obvious. So I doubt you have that. But then the third thing that could be causing some issues that you need to figure out is the nerve openings are becoming what they call stenotic. Have you ever heard that word?
I haven't. What does that mean?
Stenosis is just basically the openings where the nerves and the spinal cord, they're getting smaller. Sometimes they get smaller because things are out of alignment. Sometimes they get smaller because the disc is thinning out. And sometimes they get smaller because there's maybe arthritis or deterioration in the joints. And the reason you will get arthritis, just so we clear this up now forever, it's not a genetic thing. It's a time over trauma thing. Does that make sense at all? It's like we ride your car with the tires out of alignment enough years. Tell me what you know the tires are looking like, sir. They're going to be a little thin.
Right.
Yeah, that's really arthritis in its nature. Anyway, one of those three things are happening. And the reality is, and the recommendation is that, gosh, I wish I could reach to the phone, fix it for you, but I really need you to consider somebody who does something like that in a functional, logical way and gets to the root, not just because I'm telling you, and not because you're having pain. It's because the organ issue that you're noticing, the knee problem that's causing your life to be less fulfilling, those are the things that just suck the life out of you here over the next 10 years. Don't let it happen, man. You can start reversing this. And remember, you heal. The doctors don't. You turn loose those nerves. You get that body working again. You're going to repair things you never thought could get better. You're not old. Remember that. People telling you that. Have you thought that yet?
No, not yet. Not yet.
Good. Don't go there. You can be pretty young for a lot of years. You ain't getting out of this thing alive, but you could do better than they're telling you if you listen to the critics. All right. Well, we're going to stop the call today. And, of course, if you want further information on that yourself personally, you can go to our website, drkevinwall.com or theunpluggedhealthcast.com to find maybe follow-up stuff and what to do if we didn't fully help you. And if you're listening to this, we can obviously have you do the same. All right. Well, we're going to move on to our next caller. Thanks so much for your time today. And we hope we brought some value to you. For the listeners now, if you will, we're going to be back in a few moments with our next caller.
After an injury, it can feel like life's on hold. But at AFC, we're here to help you get back to what matters. With personalized injury plans and our expert staff, we don't just treat the pain, we guide you back to strength and confidence. Because getting back isn't just about healing, it's about thriving. Call us or visit our website to start your journey today.
All right, welcome back, and we are ready to go with our second caller today. We are talking with real people today who have real problems, and we're trying to help them find real solutions by making them think a little different, by exposing some of the confusion that's been going on within our healthcare system, and trying to help them think clearly, see clearly, as well as you listening to us and watching online, that you could maybe get some value out of the conversation. So, all right. Well, we have Jennifer on the line here, I think from Jonesville. I think that's Arkansas. So are you there, Jennifer?
Yes, I'm here.
Awesome. Well, thanks for your time here. And as I had sped to the crowds, but just to say again that this we know is not her real name. We're protecting her privacy so she can share, and we can maybe figure out, look behind some of the actual curtain and see really where some of the stuff came from. So, all right, we're going to get right to it. Jennifer, if you would, tell us if there was a magic wand, which I like to carry around, and see if I can't magically help you with one problem or so, what would it be?
I would say it would be my skin condition that leads to joint pain, and it's been ongoing probably in my mid-20s, and I haven't got a solution or anybody really trying to figure out why I have the skin conditions I have. So I would focus my I guess you can put your magic wand to that for me.
All right. Well, let's see what we can do. This is a great example of kind of our topic today. We started the show off. We talked about the concept of digestion and indigestion, and let's see if any way this would relate to what we're dealing with here. But let's start off, if you don't mind, Jennifer, with a few questions. When you say skin and joint, when is the first time you ever noticed either one? What was the first day? How many years or days or what?
It was in 2017, and it was actually right before I was about to get married, and everybody kept telling me, oh, it's stress-related. You're just stressed out from, the wedding. You just need to calm down. So I really thought that that's what it was, because I never had anything like this prior. And I'm really healthy. I don't really have very many other ailments other than the skin condition now. And I believed it. Well, it went to where I had to go to a dermatologist to kind of get, some feedback to see what I can do to get these skin rashes that automatic or just all of a sudden appeared. And they, kind of diagnosed me, but weren't really sure, because what the diagnosis was mostly happened in men, is what I was told. And there was no cure for it other than UV treatment. And that was really expensive. So I never really got a really good answer. And I'm still having these issues till this day.
Okay. Well, thank you for sharing, and I'm so sorry you've been dealing with that, especially just as you go into a newlywed. That's surely not something you want to have to deal with on top of the difficulties it is to just stay married sometimes. So let's see if we can help. All right. If you don't mind, because this is a common thing that I hear and often people say, and I'm not saying it's not true, so we never want to be offensive, but at times I will gently confront or just butt up against people. They say they're really healthy, but often that kind of means I only have one or two things going on. Is it really zero things or one or two things going on?
Well, I did have past things going on. This past 2 years, I've had a full hysterectomy, and I had a thyroid removal, a partial thyroid removal. Yeah, so I've had a lot go on in my life. I'm so sorry.
Do you mind me asking if you're willing to share your age?
Yeah, I'm 35.
Oh my goodness.
Yes,
that is way too young to be missing organs, right?
Yes. Yes, exactly.
All right. Well, that seems to be. So you're telling me you had to have symptoms or signs from that before they just took your organs out, right? Like, when is the first time you ever had maybe cyclical issues? Because I assume that's maybe what some of this started as.
So I didn't have the cycle issues until I was pregnant with my fourth child. I was in my pregnancy, and I was having abnormal bleeding, and they could not figure out where the abnormal bleeding was coming from. At one point, I thought I was having a miscarriage, so I was really worried. They kept doing ultrasounds, and they couldn't really pinpoint what exactly was going on. So that's when that had started, and it was after even having him, I was very irregular with my periods. I've had them all the time. It never really stopped. I was always spotting or having heavy flows for long periods of time. So they didn't understand what was causing it. Yeah.
Oh, okay. When was the last child born?
Last child was born in 2019.
Okay, so now we're at 5 years, maybe 6, somewhere in there, the last one. And we had a caller just on one of our last shows that was just similar to you in a lot of different ways. You may want to listen to that podcast when it comes out there for you to. But she had 4 children. Everything was fine until the 4th child, exact scenario. And this is something I've seen many, many times. Hardest thing on any woman in her life is probably going to be the holding the pregnancy process, the delivery process, the post-delivery process, the growing up of children. I mean, it's physically hard on your body, especially your lower body, your lower back, your pelvis, your lumbar spine, all those areas and all those nerves that control all those organs that have kind of went awry since that child. So often we go to the organs like that and say, gosh, oh, hey, these organs are bad and I got to go get the organs removed. Holy mackerel. We forgot to check where the organ energy came from. That was the back and the nerves from the back. I'm just having to bet your lower back has not been very healthy since that last child either. Am I right?
Yeah, exactly.
Yeah. Mm-hmm. See, there is just, we're so going backwards on this. We're going to the organs first. When the organs are connected to the spine by the nerves, and the nerves in the spine connect the organs to the brain. And if we disconnect the brain to the organ, what do you think happens to the organ, Jennifer?
Well, it's obviously not functional, so it needs to come out.
That's what they see, right? When I think, man, we got to go back and turn back on the circuit breaker, right? I mean, they didn't even try to anyone look at that, anyone even consider looking at your back before they remove the organs.
No, actually, they didn't.
Oh my gosh, I'm so sorry. Yeah. All right. Well, you got some work to do. And remember, as I use my disclaimer, I'm not your doctor. I'm just playing one on TV today. I am a provider, and I've been through 35 years of this. And I'm telling you, if it was my sister, my brother, my mother, that this has got to be different, because you are not done unless you decide to intervene. Right. So the rule that still applies, as much as you may not believe, is the healer, the doctor is you. Right? Okay. The healing is an inside thing, not an outside thing. If you look inside the system, you may find that the system that's running the organs is still having a problem, right? Your lower back's still bothering you, right?
Yes.
Yeah. Okay, well, I could go to your skin problem, but your skin is not an outside problem either. So it's not a rash that you're allergic probably to something. It's not the air. It's not the pollen. It's not the, you name it, lotion. I'm sure you've tried it all, right? You've considered moving and removing and changing, and nothing works because it's not an outside issue. This is an inside issue. Something is wrong inside, and the skin is reflecting it by whatever is toxic or chemically off. The system's bad from the inside, and it's just extruding things through your pores. Started 5, 6, 7 years ago, longer. So I know there's been histories we probably haven't discovered today. But I can tell you that whatever started the system, and it could easily be. Did you ever have injuries to your back years ago, before the kids even?
Not that I know of, no.
So you weren't a dancer, a gymnast, a skier, a high jumper, or something like that?
No.
Okay. And did you ever have lower back, you said, not before you got married?
Well, I did before I got married, because I did have 2 children prior to my marriage.
Okay. Well, sorry.
So
didn't mean to make you feel uncomfortable there, but I appreciate that. All right. Totally. So, well, we're getting back, and you're seeing, and I don't need to keep making you feel bad or other people, but people should be hearing this, and you should, right? That if we look at this from a little bit more of a global perspective, we probably think that the lower back or the issues there need some help first. And if we can turn on the system that runs the other systems, and then we start working with your digestive system maybe, or somebody does, because is it possible that you have indigestion also, or things like that?
Yes, probably, yes.
Of course.
Mm-hmm.
And so those things are the roots, because if the system that repairs, turns things on, keeps things going is not on, then we're in trouble. But if the system that brings you energy and brings you food is not working, then we're secondly really bad in trouble, right? So before we start treating your skin more and removing more organs, please let's go find somebody who actually can help your lower back and somebody who can actually help your digestive system. Here's just some thoughts, and you go on to our website, unpluggedhealthcast.com. You'll find resources for people that maybe we trust that you could consider, and or look for a naturopath or a functional medicine or a physical medicine, or maybe a chiropractor who's not just cracking backs, who not the joint. That's not what I'm saying. That does, whatever, if you know what I mean by that, these treatment facilities out there just cracking spines without exams, x-rays, people that really look to the insides, fully exam, x-rays, evaluate, MRIs, whatever it is, to really find out where your back has went bad and where maybe your digestive system could get better. Okay, well, we got to move on, and thank you for your sharing. I hope that helped in any fashion. But again, if you need more information, go to drkevinwall.com, and you'll find our website, or at the unpluggedhealthcast.com, and you may find more information there as well. All right, guys, we got to move on here. We have one more caller today before our show is over. And right now, before we bring that last caller on, we're going to take a quick break. I'll see you in a moment. All right. Thanks for coming back, and we are back live here at the Unplugged Healthcast, where we're having real conversations with real people, talking about real problems. And our last caller today is Charlie from Chicago. This is a unique one because it's a conversation about something many of you maybe have never heard about, and he's going to explain a little bit. We're going to talk briefly, but it does open up a conversation that I'd like to maybe discuss on some other ways to think about how to be healthy. So, Charlie, are you there?
I am.
Awesome. Well, thanks for joining us. And as we have told everyone, this is we know it's not your real name, and we're protecting your privacy. So hopefully you feel comfortable in sharing with the people that are listening, and they can learn, and maybe I can learn, and maybe you can learn, and we can learn together. All right. So you okay with that?
I am.
Awesome. All right. Well, I always say if I have a magic wand and I could help one problem, I think you're a pretty healthy guy from what I hear, but maybe there's one thing we could talk about. What would it be today?
So I struggle with a condition called gallbladder syndrome. It pretty much is explained as benign, but occasionally my bilirubin levels will show that they are very elevated. And sometimes it can cause some gut issues, a little bit of bile in like my mucus and throat and all of that stuff. So I was just hoping to learn a little bit more about that.
Okay. Well, again, I am sorry you're dealing with that, and I'm glad that you called because a lot of people have been told those things. So this is a classic story that you got something, it's genetic, and you got to live with it. All right. Well,
yes.
Let's break that down just a little bit, and a couple of questions. Maybe if you don't mind, I'll ask you. Today, we have a lot of DNA floating around in your neighborhood, in your body, around your family. And today, the DNA, the genetics that we are having today, do you think it's that much different than it was 100 years ago?
I do believe that there is a significant difference, but with every passing generation, we're going to get some differences for sure.
There's definitely some changes as people share their genes, but in general, the genetic mutations that seem to be causing these things haven't really modified that much over the years, but we surely have got a lot more conditions showing up that seem to be genetically related. So whether the genes are changed or the environment we're in has changed, I have a tendency to think that it's a crack that makes the roof leak, not rain, which means that if you have a crack in your roof and there's a lot of stress, you'll notice a problem, right? So when your body has a genetic abnormality and stress occurs, things show up. But it just doesn't mean you always have to be this way. There are things people could do, things that we could consider, and thoughts that we should have, that just genetics does not determine your future. You can have answers that talk or bring thoughts that you should consider. The first one is, do you know, Charlie, what your bilirubin even does for your body or why it's there?
I don't.
Okay, a lot of people don't, so I always encourage, and whether this is your condition you're listening to or a different, the first thing you should do is go understand what they're telling you. Bilirubin, and I'm not going to go in depth, and I'm not an expert in everything, including liver problems, but I will tell you I know enough to know that we're talking about your liver, your gallbladder, and its effects, because bilirubin is actually part of the process that your gallbladder is dealing with when it's trying to digest and work and to help you break fats down. Okay? So when you don't have the right amount or the wrong amount or too much or too little of this, chances are that one system is going to be effective. Any idea, Charlie, what system is going to be affected if your bilirubin's off?
It'd be the endocrine system.
Well, close. It definitely can be affected by that. But usually the first thing is your digestive system, because when your gallbladder and your bilirubin or your bile is wrong, then you can't digest fats correctly. So like, see, you told me you're having some digestive things here when these numbers are off?
Sometimes, yes.
Yeah. And have you noticed yet that it's kind of associated with eating fatty foods?
I actually haven't noticed that.
Well, see if you can pay attention and notice the pattern, if it's there or not. Chances are it is. I'm usually, pretty close at times when I've talking about this, but in general, the thought here is, okay, let's understand the problem. Let's look at what the problem means. Let's don't just accept that I have to be this way, because bile and your liver are all connected. Bilirubin and your liver and pancreas are all connected, and unfortunately, it's connected to digestive system. So as young and healthy as you are, as you live like this, thinking nothing can be done, do you have any idea what the future looks like if your digestive system or your liver's not working that good?
No.
Well, do you think it's good or better or worse?
Well, it's definitely worse.
Yeah. All right. So let's just see. All right. In the effects, if we learn anything from this, and thank you for sharing here, that we want to look a little deeper into everything we've been told. We don't always have to live with genetics as our future, and there are maybe conditions that could be better, even if you have been told they can't be. The first thought I would have if I were you, and again, I'm not you and I'm not your doctor, so I can't give you recommendations, but I can think out loud if you're listening. And that's, I wonder if my liver could be better. I wonder if my gallbladder could be better. Have you ever done anything to cleanse your liver? There are liver detox systems out there, nutritional ways to go about that. Have you ever looked into that?
I've done a couple of those, taken some milk thistle, that kind of thing. I do notice that sometimes that's different. I do notice that my stress levels tend to elevate my bilirubin as well.
Yeah. Yeah, so that definitely has factors. Like I say, the more it rains, the more your roof leaks, right? So we got to see if we can make your roof stronger. And so the way to do that, again, is back to the liver, back to the digestive system. So you're not going to be able to do the little average things to try to make your liver better, because you're not average. You've never been average, I'll bet, and this isn't an average problem. So you're probably going to need to talk to a naturopath and somebody who understands the liver and see if they can actually get your liver to be a little cleaner, a little healthier, work a little faster. They also should look at doing a gallbladder flush. Have you ever done that before?
I have not.
Well, again, you need to get your gallbladder as clean as it can be. Don't wait for the gallstones to build up. They're probably already going for you with this issue, because that's your weak spot. That's your crack in the roof. And if we don't look at that, we probably are going to wait till you have a gallbladder attack. And like 3 of the callers we already had here in the last few sessions, they've had their gallbladders removed or dealt with, and we want to keep yours. Would that be okay if we keep yours?
I mean, yeah, I'd rather keep it if I could.
100%. All right. Well, I'm going to kind of shorten this one because the information here is not conclusive, but it is something we should direct you and others to think differently, consider different options. Don't live with it. Go find answers with doctors who think through the system. Digestive system, we have ways to help you digest fat better. They're out there. Look at it up. We have ways to make your gallbladder better. Look that up. Go find somebody. And we have ways to make your liver better. Look that up. Find somebody. But don't just sit home and wait until the red oil light turns into an engine problem and you drop your transmission. All right. Well, we appreciate you, Charlie, for calling in and for your time today. We're going to let you go, and we're going to wrap up the show. All right, guys. Well, here we go. We've wrapped up another one, and we're thankful for you chiming in, staying on. If you want more information, remember to go to drkevinwall.com, and you can find information on our website about today's show and other shows. You can find resources to get to get answers, to find solutions, doctors maybe to follow and find that we find are healthy, they're trustworthy, they're worthy of you considering to check out. And ultimately, you can actually just follow us online, subscribe so you can listen to more podcasts, learn more, because other people have symptoms and conditions like you, and you're going to learn as you listen. Please share this. If you don't mind, go give us a 5-star review, because if you do, the algorithm promotes our show, and we get to reach out to more people, help more people, and that's what we're here for. All right, until then, this is Dr. Kevin Wall. This is the Unplugged Healthcast, and I'll see you next on the next show.